This case study is presented by Cindy Guzman, and it is a case study of parent-child interaction therapy for the treatment of autism spectrum disorder. Abstract. This case study examines the efficiency in parent and child interaction psychotherapy. It's a concrete proof approach for small kids with disturbed conduct. It highlights behavioral issues in a 7-year-old boy having autism. Background. Autistic kids appear distracted, negligent, and hostile. They find it challenging for them to participate in educational tasks. They have repetitive behavior. Studies show that 1 in 88 children and adolescents are affected by autism. Factors surrounding autism spectrum disorder. This is a really good compiled chart explaining the many disorders and in terms of the gene, the sleep gene, family factors, anxiety, depression, environmental, and mechanisms that can be helpful. Research basis. Best therapy for children having autism is applied behavior analysis. The case is an application of PCIT to a 7-year-old child having autism. The effectiveness of the treatment was evaluated. Overview. This 7-year-old boy is awaiting medication evaluation. His demeanor exhibits hostility towards instructors and parents. His conduct was impeding his capabilities to participate in school interrelationships and achieving learning activities. Assessment. A psychiatrist performed a thorough evaluation, including behavioral monitoring. The evaluation showed that he had autism spectrum disorder. According to the findings, Kian issues habits were evident. PCIT was suggested as part of the intervention strategy as an effective therapy, including youngsters with disturbed conduct linked to autism. Kian was not reacting effectively to recent mental medicines. His prescription was altered twice throughout PCIT. The incapability to include school personnel in the therapy hampered Kian's capability to generalize new abilities. On my personal view, regular training at home should be emphasized. Kian's conduct would strengthen within time. Youngsters believe their parents as a result of such encounters. Creating awareness of autism and therapy is very crucial. Future implications. This case study will offer significant data for the efficiency of PCIT. With help, curing kids with autism will cure condemned cognitive impairment, determine stereotypic mobility condition, and recurrent insomnia. Conclusion. PCIT provides a successful therapy in autistic kids. If needed, physicians should be adaptable and innovative. They should adhere to therapeutic guidelines. My recommendation is setting up more clinic time for parents and guardians of children with autism. Clinicians should engage more schools with intervention strategies on autism. Improvement for Kian's behavior due to PCIT showed the effectiveness of the therapy. Creating an environment where children with ASD can comfortably thrive in Paramount. These are my references. Thank you very much.